Okay, so today we are doing Ceph tracing, and you know the details of a lateral Ceph because they've been discussed with you in the class lecture already. And as you can see, we have different components to a Ceph. There is the soft tissue outline, the hard tissue outline, and then the dentition, the maxillary and the mandibular. So the Ceph is basically a 2D representation of a 3D structure, and since it can become very difficult to locate some of the deeper structures, especially the bilateral structures, I will start with the more tricky ones first. First and the foremost that you have to locate is basically the porion. As you know, it is a continuation of the external acoustic meatus towards the internal acoustic meatus, and the cephalometric landmark is called the porion. So how do you locate the porion is that if you draw an imaginary line through the midline of the cervical vertebrae at the level of the condylar height, and using the external acoustic meatus, it should be upwards and backwards. So this is just a rough estimation of where the porion shall be located, right? So you start with that, and then we know that this is the condylar head along with the neck, the notch, the ramus, and then I will continue to draw the lower border of the mandible. So please be a little careful when you are working on this structure because there is always a cortical bone over here. Do not mix that up as the lower border of the mandible. Continue to draw the C2 or the second cervical vertebrae, C3, and C4. Always draw with a firm, steady hand instead of having numerous sketch marks on it. Okay, now we will proceed on to draw the sphenoid bone. As you know that there is the sella turcica along with the sphenoid bone over here, the anterior cranial base, and then proceed posteriorly towards the okay. Now the orbit is a bilateral structure, so we are going to draw the two outermost margins, and this is going to be a crescent shaped structure that we are going to then make a mean line out of. So this is one of these is going to be representing the right side, the other one is going to be representing the left side, and in order to draw the mean, I will make a dotted line over here. So this is basically the structure that I will continue to use for my cephalometric tracing from now onwards. Now, the easiest structures are always the midline structures. So starting with the soft tissue outline from the forehead, coming down to the tip, to the nose, to the root of the nose, the full length, the tip, towards the lip, the upper lip, the lower lip, and then the chin, followed by some amount of the neck. Now, for the midline structures of the hard tissue, I'll start with the forehead. The most prominent part of the forehead is going to be called the glabella. Coming down to the nasion. Now the nasion, as you know, is basically formed by the nasofrontal suture, and that is going to be present between the two bones. You have the nasal bone here and we have the frontal bone over here. And if you can see this faint radiolucency over here, This is basically demarcating the, this demarcation is basically the nasion point. And the most anterior point of the suture is going to be the point nasion. Okay. Now, I need to draw the maxillary jawbone. The anterior limit will be from the anterior nasal spine, and the posterior limit will be till the posterior nasal spine. So I can see this bone here. Along with that, draw the incisor, the central incisor, from the apex to the tip, or the incisal edge. Now, the posterior limit of the maxilla is usually told to us by the pterygomaxillary fissure, as this marks the posterior limit of the maxillary arch. So if I draw this fissure and if I take a dotted line down, this tells me where the posterior nasal spine is located. Okay. Now, for the mandibular dentition, draw the incisor, symphysial bone, now the molars, the first molars are to be drawn. Along with the upper first premolars. Okay, so sometimes students become a little confused as to the position of the molar. This can usually happen because of the superimpositions, or it can be due to the machine as well. So we have a structure over here, this is called the key ridge. It's basically a continuation of the orbital bone, and this tells us, and right below this is basically where the upper first molar should be always present. Now for the occlusal line, this is basically known as the occlusal line, and we need this because we are usually working with the functional occlusal plane. And that's it. You're done with your stepwise tracing technique for today.